Environmental and Cultural Factors on Post-Traumatic Stress Disorder by Amanda Coombs. The event of the media has set forth profound changes with regard to the attitudes and behaviors of individuals who engage with the media. Over the years, media have been used in many ways and have had different effects and outcomes, some positive and some negative. Media plays a large role in what the general population and lawmakers associate with PTSD. In the media, PTSD is often portrayed with serial killers, villains, and veterans. In general, mental illness is often portrayed in a scary light in media. They are always killers and described as sick people that need help. These negative themes could create misconceptions that people who have PTSD are dangerous and discourage employers from hiring prospective employees with this disorder. Video games have horror genres that always take place in old mental institutions where it is deemed dangerous. Deceptions that may have an impact on people's perspectives about mental health illness issues and patients have been set forth by news media framing of PTSD. Cultural environment for family support. It's common for people with PTSD to withdraw from family and friends, and while it's important to respect your loved one's boundaries, your comfort and support can help that person with PTSD overcome feelings of helplessness, grief, and despair. And in fact, experts believe face-to-face support from others is the most important factor in PTSD. Recovery. A family support and understanding can be invaluable in your loved one's journey to recovery. Cultural environment, role of peers. Social support has been consistently identified as one of the strongest predictors of PTSD. The presence of increased peer support will associate with higher levels of hope and less functional impairment in daily life. Peer support and peer-related problems can have a strong association with psychosocial outcomes. Cultural environment, cyclical nature. A person with PTSD will likely experience arousal or a constant alarm signal, with strong emotional indicators of arousal experiences, including problems of falling or staying asleep, irritability or outbursts of anger, difficulty concentrating, startled reactions, jumping at noises, or always feeling on guard or looking over their shoulder. Re-experiencing events in some ways, such as nightmares, dreams, and flashbacks. PTSD individuals have intrusive memories when there is something in the environment to remind them of a traumatic event. Avoiding reminders of an event. A natural reaction to intrusive memories or strong emotional reactions is the urge to push these thoughts and feelings away. We might avoid places or people who remind us of the event. Sights, sounds, smells, we tend to avoid these to escape from reminding us of the event. And then there are cognitive shifts or mood-based shifts that can start to occur, and we would start to reconstruct our beliefs and the world around us and ourselves and start to reshape how we perceive others. Cultural environment on legal or political systems. Although knowledge about the post-traumatic stress disorder, PTSD, has grown over the past 40 years, PTSD policy research is undeveloped. And this gap in knowledge warrants attention because policy is among the most powerful tools to prevent and mitigate the effects of PTSD. Research is needed to understand knowledge and perceptions of PTSD among policymakers and the public to inform science-based advocacy strategies that translate the full spectrum of PTSD research into policy. Some potential barriers for the cultural environment are acknowledgement of survivors. So across many cultures, trauma survivors may experience stigmatization and lack of acknowledgement. The negative role of the lack of social acknowledgement has been demonstrated in several studies recently. Negative attitudes towards trauma survivors in a society result in avoidant help-seeking behaviors. The lack of social acknowledgement of trauma and its effects result in inadequate healthcare policies on a national level. Avoidance and trauma disclosure. One of the core PTSD symptoms is avoidance. Survivors with PTSD symptoms very often avoid disclosure of traumatic experiences and trauma reminders and may be reluctant to seek help. Studies on the disclosure of trauma have revealed that it is a significant predictor of PTSD symptoms. In combination with a lack of acknowledgement of survivors, trauma disclosure may be affected. This results in avoidance of healthcare services, even in contexts where evidence-based treatments are available. Limited resources. Evidence suggests that psychological treatments for trauma survivors are the most effective treatments for PTSD. However, qualified medical doctors and psychologists with training in trauma-focused treatments are needed to provide these treatments. So, poor health care infrastructure and the lack of training institutions may be a significant barrier to providing trauma-informed evidence-based treatments into many countries. Surprisingly, even in many European countries, access to high-quality evidence-based trauma-focused treatments is limited, as reported by the recent analysis of trauma treatments in 7 European countries. And then there's also ongoing conflicts and disasters. It is extremely difficult to provide PTSD treatment in a country with an ongoing conflict or even a war. So findings from studies in post-conflict areas also indicate that PTSD rates in these countries are significantly higher. Cultural environment on international scope. PTSD is known throughout the world, and there is no known region or population that is distinct about PTSD being dangerous or having people shun them. This is just going to be based on whatever area you live in the world and what problems you're having at the time. I have not seen any kind of religion that will shun you for having PTSD. So health disparities or socioeconomic status. Low socioeconomic status may be associated with use of various mental health services in various settings. Several studies have reported that low education and low income are associated with reduced use of mental health services, which may attribute to the cost of private sector care or different perceptions of need among persons with less education. However, low income has been found to be associated with greater use of mental health services in some samples, and some studies have reported no association between income or education and use of mental health services. Thus, the relationship between low socioeconomic status and use of mental health services is difficult to distinguish. Health disparities on race and ethnicity. Differences in risk for trauma varied by type of event. Whites were more likely than any other group to have any trauma, to learn of a trauma to someone close, and to learn of an unexpected death. But Blacks and Hispanics had higher risk of child maltreatment, chiefly witnessing domestic violence, and Asian, Black men, and Hispanic women had higher risk of war-related events than whites. Health disparities on religion. Religiousness and spirituality have been shown to be important and commonly used resources. Most often, religious meaning systems provide a helpful vehicle for making sense. Religion can be involved in changing the appraised meaning of stressful situations, and it's a source of stress if religious beliefs or attributions suggested maladaptive ways of understanding an event. Health disparities for gender. Females showed higher rates of PTSD than males, and even though they were exposed to the same traumatic event, females displayed higher levels of depression and anxiety, while men displayed hostility and alcohol or drug abuse. The negative stereotypes of PTSD patients may represent a certain type of reflection to the way both genders act. Health disparities, geographical location. There's a substantial heterogeneity worldwide in the distribution of exposure to traumatic events. Research suggests that there are certain geographical areas where large populations are constantly exposed to large-scale traumatic events such as wars, organized violence, terrorism, and natural disasters. Telemedicine has faced several barriers over recent decades, including technological and equipment challenges, cost, and regulation, but recently these barriers have been decreased. Advances in technology and recent healthcare reforms, such as the American Recovery and Reinvestment Act, the Health Information Technology for Economic and Clinical Health Act, and the Affordable Care Act, support the coordination and alignment of healthcare systems by means of such technology. Avoidance for health disparities for bias. Avoidance of stimuli that are associated with the traumatic event is a key feature of post-traumatic stress disorder. Thus far, studies on the role of avoidance in the development and maintenance of PTSD focus primarily on strategic or explicit avoidance. However, patients may also show implicit avoidance behavior, which may remain even when the explicit avoidance is reduced. Avoidance of threatening stimuli serves an important function for PTSD patients. It prevents recollections of the traumatic event and thereby the negative and fearful thoughts, feelings, and cognitions associated with the event. By avoiding recollections of the trauma, patients protect themselves from danger and being harmed again. Due to this avoidance, however, patients also prevent themselves from learning new response patterns because they do not fully subject themselves to the emotional processing of their anxiety.